So thanks everyone for joining me. My name is Vicky Hobbs and I pride myself on being a pregnancy, birth and postpartum specialist. I'm based in the northern suburbs of Perth in Western Australia, and I started my business in 2004 with remedial massage and aromatherapy, and then I started specialising in working with pregnant women from about 2006. Now, I just want you to know that we do have a question and answers section at the end of the webinar today. So if you can leave all your questions for that time, and I'll endeavour to answer as many questions as I can in the time. If I can't answer anything, then I'll find out for you, and I will send the information through to you when you get your video link as well. So I'm just waiting for my slide to go through. So today's webinar is all about going back to the birthing basics, using your 5 senses as a guide. This webinar will run for approximately an hour, so I'm going to try and give you as much information about using your 5 senses and giving yourself some tools and techniques to have a positive, calm birth. So all the resources that I provide to you, you'll also get information after the webinar as well when I email through to you, and that will give you some more information so that you can follow up. So you're here today to get some information on how to achieve a positive, calm birth. I'm going to give you as much information as I can. You need to have an idea of what to expect during birth. You need to know how to deal with fear and negative thoughts when they arise. You need to understand what is happening in your body and how to change things in the moment if they're not working, how to use tools and techniques for a better birth experience. You just can't go into birth thinking that you'll go with the flow. I've seen so many women who come to me afterwards and say, you know, I just thought I'd go with the flow and everything, you know, didn't go to the way I thought it was going to go. So it's really important that you educate yourself. How you prepare and practice your tools and techniques for a positive, calm birth will make a real difference to how you feel about your birth afterwards and during the postpartum period. So preparing for your birth with your partner is also a really great way to develop an incredible bond before, during and after the birth. Your partners will feel so much more confident and useful. Gone are the days when your men just set out, or your birthing partners just sat outside waiting for the labouring woman to give birth, or, you know, sitting in the corner watching TV or just reading a book or watching their watch. You know, wondering when this birth was going to take place, or, you know, just leaving everything to the midwife. So these days, partners need to step up. They need to be your best support person on all levels. So that's the physical level, the mental, the emotional, and the spiritual level as well. So your birth matters. The way you birth can have a profound effect on your postpartum period and the bonding with your baby as well. So my first birth was incredibly traumatic. I had special circumstances, medical emergency. My baby was born at 32 weeks, and I just didn't think any of that would happen. In fact, I was one of those ones that said, hey, you know what? Women have been birthing since the beginning of time. I'm just going to go with the flow. I'm just going to go in there. I'm going to pop this baby out and everything's going to be great. And that's not what happened. And I had so much fear when everything was happening, and I had no idea and nobody was talking to me. I didn't feel I could ask any questions. It just, bam, it just happened. And that took a lot of healing for me. In fact, several miscarriages later, before I actually had my second child, 15 years later, 7 miscarriages. So it really did have a huge impact on my mental state. Even during a cesarean, you need to make sure that you're breathing. You need to make sure that you're calm and relaxed. You need to make sure that you feel supported, that you feel loved and cared for. And that can make a really big difference to your postpartum healing, your bonding and your breastfeeding as well. So my advice to you is to get as much information about normal physiological birth, natural birth, birth without drugs as a first preference. Once you start intervening in the normal natural process, then you need to accept the risks that come with that. You need to accept that you could trigger that cascade of interventions. So my goal today is not to get into all those risks. That's a totally different webinar, but to share with you the tools and techniques to help you feel calm, to help you feel relaxed, to help you feel excited about your birth, because that's what I want you to do. I want you to feel really excited about this baby that you're going to give birth to. But I also think that you need to do your research. You need to prepare yourself, and you need to feel confident about your birth. So although women have been birthing since the beginning of time, birth itself in Western culture has actually slowly changed, becoming more medicalised and more clinical. If you want to have a normal natural birth, then again, I say it, you have to educate yourself. You have to prepare yourself for a normal natural birth. I really recommend that you go and do independent childbirth education classes, not just the hospital antenatal classes. You need to find out more about your hospital's policies and procedures. You need to find out more about the obstetrician that you've chosen to birth your baby. You need to find out more about, how you can make a hospital birth a better birth. You need to do your research. You need to find out the hospital guidelines. And if that hospital is behind the times with their policies, you need to research the different choices that you have available for your birth, because there are so many choices for birthing. You can have a hospital birth, you can go private, you can go public, you can go to a birthing centre, you can have a water birth, you can have a land birth, home birth, you can have an independent midwife. You can also join the community midwifery program. You can have a doula, or you can have a professional birth support person there. Some women even free birth because they feel that the system won't support them. So I'm not encouraging you to go choose a specific way of birthing. What I'm saying to you is that you actually need to research all those choices and find out what's going to help you have a better birth. And when I talk about independent childbirth education classes, this means that you're going to have to pay. You're going to have to pay someone to give you all this information, to give you resources, to give you support, okay? And the difference between a independent childbirth education program and going to your antenatal classes at the hospital is that going to an independent means that that person is totally trained in childbirth education. They're totally up to date with different policies and procedures. They are trained in demonstrating how to have a positive, calm birth and to give you tools and techniques to have a better birth, no matter how your baby chooses to be born. So I teach the Hypnobirthing Australia program, and I really feel hypnobirthing is an incredible program that allows, gives you all these opportunities, all these tools and techniques. It gives you a practitioner who is dedicated and passionate about sharing their experiences and their knowledge and giving you that confidence and having a go-to person that can provide information and resources and evidence-based information as well. So I really encourage you to do childbirth education classes with an independent person. Now, you also need to interview your caregivers. for the job of birthing your baby. And what an important job it is. But most importantly, you want them to leave you alone. You want them to just stand back, just observe what's going on, check out, any risks that might come up, and then guide you and provide you with information and share with you options that you have, and give you the opportunity to know that you do have options. You can say no if there's no medical reason to do something. You can actually say no. So it's about being confident. It's about understanding the birth process. It's about understanding what your body is actually doing, and knowing how to change things in the moment if things are not going to plan. Remember, you're the consumer, and as a consumer, you have a voice. Many women think that because they go private, that they're going to have a better birth. You might get really nice facilities and a beautiful private room. Your partner might be able to stay with you. But what is really important to you? Research shows that women who have private obstetric care experience more interventions. So this includes being pressured into induction at 38 weeks, stretch and sweeps, artificial rupture of membranes, artificial oxytocin, and then constant monitoring and cesareans. So you need to be able to understand what's going on in the moment, and if there is that opportunity to change what's not working at that moment, doing different things. If your labour starts to slow down or stall, there are things that you can try and do to increase those contractions, to increase what's going on in the moment. So you need to work out what is important for you, and understanding that you are the consumer, and as a consumer you have a voice. So shop around, do your research, find the hospital and the obstetrician that has the least number of interventions and cesarean rates. So, and more importantly, someone who will listen to you, someone who will answer your questions, someone who will provide you with evidence for whatever they're sharing with you. So look at what's important. I also want you to surrender to all the sensations that you're feeling. And when I talk about surrendering, I mean that on all levels. Surrendering in and letting go of all fear, stress, tension, doubt, anything that might inhibit your birth. Remember that you're the most important person in that birth room and in that space. What you want really matters. So again, I'm telling you, find your voice. You need to be able to know that someone is listening to you and respecting your choices. In that moment, you are the one that's working hard. You are the one that's labouring away, bringing your baby into the world. So remember, you have a voice. And if you don't like something, then say no. If you want something, then say so. Do not worry what anyone else is doing or saying or feeling. Stay positive and be positive. And I really love this image that I've shown you, because this, to me, just epitomises that beautiful pregnant woman, being out in nature and releasing and letting go. And as Anna Mae Gaskin says, if a labouring woman doesn't look like a birthing goddess during her birth, then she's not being treated right. And that is really important. You need to feel that you are being respected. You need to feel that you are being listened to. You need to feel that you are the most important person in that room. So your birth support people are really important as well. So this is your partner and anyone else that is there to support you. So probably a doula, or maybe even a friend or family member. Excuse me. They need to observe what is going on in the birthing environment. They need to look at how the mum is reacting or what she is experiencing. Look at whether or not she needs some food or some water for hydration. Or look at whether she needs some encouragement or a change of position or some music. If things start to slow down or stop, what was working before may not be working right now. So if the mum is becoming stressed or anxious, you need to reassure her and show her support and love and safety. Remember that women may not think or speak rationally in the moment either. So one minute they may want a massage, the next minute they're telling you to stop touching them. So don't take it personally. This is really normal. So if a woman has the ability to go into the primal brain, the birthing brain, the instinctual brain, then she may be so focused on her mind and her body, and she may be so quiet with her eyes closed that you may think she's asleep. Yet she may be fully aware, and her 5 senses are acutely sensitive to what is going on around her. So it's really important to be respectful of that mum. An important reminder for the birth support team is if it doesn't appear broken, don't try and fix it. I say this all the time. If that mum is in that beautiful zone, if she's calm and relaxed, if she's on the birth ball and she's rocking from side to side and she's looking beautifully calm and relaxed and in her own moment, don't try and fix it. Don't try and change it. If she needs something, she will let you know. Okay, so just sit back, leave her alone. Just let her have her space. Let her feel that she's in this private moment. So let the mum give you signals to ask for help. Don't get caught up trying to do lots of different things all the time. So if she appears to be going really well, then just let her be, and really protect that birth space as well. So for people coming in and out of the room, making sure that that they understand that you're the labouring woman is in this beautiful space. She doesn't need anything, and if she does need something, she'll ask for it. So it's really important to keep that space and to protect that space. So as a doula, I think about the 5 senses to remind me of tools and techniques to support a labouring woman. As a labouring woman, if you're trying to find the best course of action to get back into your birthing zone or to change things in the moment, I want you to start thinking of the 5 senses. Sometimes labouring women become really stressed and anxious and uncomfortable, or start thinking, which takes her out of the primal brain into the neocortex part of the brain, which is the thinking part of the brain. And this can end up changing things, either slightly or dramatically. So when you need to change things, and a really easy way to recall tools and techniques is to think of the 5 senses. Some of these tools and techniques can help you release endorphins. Some can bring about relaxation. Others help you to feel more energized or give you sustenance and get you back on track if you started to feel anxious or stressed. So let's go back to basics. Let's start with the 5 senses. And the 5 senses are your touch, smell, sight, taste, and hearing. So there's so many tools and techniques that come under each one of these 5 senses. And I'm going to try and give you as many examples as I can in this short period of time, so that you have an easy reference list to go to. But a good exercise for you is to sit down and map out some of the things that you feel might be appealing to you under those 5 senses, and share that with your birth team. So also keep in mind, whenever things are not going quite to plan, just think of the 5 senses to change things up. If there's no medical reason to have them delay, if there's no medical reason for an intervention, then delay the intervention. Give yourself time to get back to that feeling of being calm, of feeling positive and feeling confident as well. So touch, and I also include feelings in this as well. So when we think about touch, we do need to include feelings. How does the mum feel when she walks into the birthing space? How does the mum feel when she's being spoken to by her caregivers? Does she feel she's being treated with respect? Does she feel that her birth preferences are being honoured? How does the mum feel when she's in a certain position? So not only focusing on the physical touch, but also how she's feeling is very important during that time. The touch and feeling side of birth is really important, because if mum doesn't feel like she's being respected, or she doesn't feel comfortable, or she's feeling stressed or anxious or in pain, then this is going to affect her birthing space. It's going to affect her mental state. And more importantly, it's going to affect her belief in birthing and her belief in her body being able to birth. So here are some suggestions for your birth support people when they're thinking about techniques for touch to help you with relaxation, discomfort, releasing endorphins, which are your pain relieving and feel good hormones, exactly what you need for birth and during labour. So set up your birth space to feel comfortable for the mum. Push the bed out of the way if you need to. Get a mattress on the floor. Yes, you can do this. What I want you to do is remember that you're paying for this room. This is your birthing room. You need to be able to go into that birthing room or go into that birthing space and claim it as your own for the several hours that you're going to be in that room. So you make it your own. You bring stuff from home so that it feels homely. You know, just going into a birth space that's really clinical can be really off-putting for a mum when she first goes into that room. So you need to claim it as your own. You're paying for it. Think of it as a hotel room. So you design that room the way that you would feel the most comfortable. Light touch massage. So that's a beautiful way for the partner to actually help mums to feel relaxed and calm. Whole body massage. Get the mum onto the bed in a side lying position. Start at the feet and work your way up in really long flowing strokes upwards to help the mum get into that beautiful calm relaxed state. And then when you've done one side, get her to roll over onto the other side as well and do the other side. Strong counter pressure through the sacrum can really help mums during contractions. Hip squeeze to reduce pain and release tension through the pelvis. Learn about acupressure points. So I'll actually include a link to demonstrate some of the acupressure points with photos to make it easier for you, so you know where those acupressure points are, you know how to use them and when to use them. Rebozo technique for either moving the baby down or releasing tension through the pelvis. A rebozo is like a big long piece of material that we pop under the mum's belly. We do what's called a sifting motion to actually try and loosen off those ligaments of the pelvis and help babies to actually move down or actually turn into a different position. If you don't have a rebozo, grab the sheet off the bed and you can actually use that as well. Head massage tool, and I'm going to get to that in a moment. Water from the shower jets in the shower, or getting into a warm bath. Dribbling water from a cup over the body of the mum, so she's getting this beautiful touch of water. Giving the mum a hug can release huge amounts of endorphins, which are your feel-good pain-relieving hormones. And also recognising how the mum is feeling physically. Is she cold? Is she hot? Is she uncomfortable? How is the mum feeling emotionally? Is she fearful, anxious or stressed? How is the mum feeling mentally? So if there's negative thoughts there or doubts, then you actually need to shift that. So there's lots of techniques that you can actually do, positive affirmations. So we'll get to that as well. Reassuring her with touch can be really beneficial. So here is an example of the head massaging tool that I really love, and I use this all the time. This is one of my favourite labour tools. Do you remember what it used to be called? It used to be called the Orgasmatron. So I remember buying an electric one of these for my friends over in the UK and sending it over to them, and they thought it was out of this world. And I just remember thinking at that time, wow, this would be amazing for birthing women, for labouring women, to get those beautiful endorphins flowing through the body. So it does send an incredible sensation through the body, just like an orgasm. So if you can stimulate an orgasm, then that's exactly what you need. But obviously, I'm not saying that these will actually stimulate an orgasm. What I'm saying is that it feels like an orgasm. And if you can simulate an orgasm, then this is a great thing as well. A little less stimulating, but still highly effective, is a simple gesture like just putting a hand on your shoulder. When a labouring woman feels her loved ones touching her, you know, just holding her, then this can be a really special moment. It can help her to feel, yes, I'm safe. Yes, I can do this. Yes, I've got my loved ones here supporting me and encouraging me. It can melt away any negative feelings that she might be experiencing in that moment. So in my Hypnobirthing Australia classes, we actually use this technique in our self-hypnosis exercises. And it helps to condition the mind to have a response with a certain action or a word or a smell. So a hand on the shoulder can also be conditioning the mum's mind to help her release certain feelings, you know, release a response, to feel calm and relaxed. So that mind-body connection is just incredibly powerful. So don't think the power of touch is not important or can't do anything, because it really can. We can also condition the mind with smell. And this is one of my favourite parts of training pregnant women, is using essential oils. So most birth workers do recommend using essential oils. However, I think it's really important that you use essential oils safely. When you're in the labour, and so most of my information is coming from the point of view that you're going to be at hospital. And when you're in the labour and delivery ward or room, I recommend that you use essential oils in a spray bottle. Okay, so you're using it intermittently. Essential oils can be really strong and can be really overpowering, especially in a small enclosed space like your labour room. So I also don't recommend you use a diffuser in your labour room as well, because the ventilation is really poor. So if you have a diffuser going constantly, this can cause not only the mum to have adverse effects, but also others in the room as well. So if you're birthing at home, obviously you can use a diffuser because you're in a bigger space, and it's usually okay to have, you know, a diffuser going constantly. So essential oils need to work in synergy with each other. If there's one oil that you don't like, then that can spoil the whole blend. So try out a few different combinations of your favourite oils. I'm going to share my own special blend with you today, but if there's an oil that you don't like, you can actually take that out and you can substitute it with another oil that you prefer. When you're testing for synergy of the oil, so synergy means, you know, that working together that creates that beautiful aroma. So when you're testing for synergy, you take the lids off each of the bottles of oil and you hold those oils together in your hand and you waft the bottles of oils under your nose at the same time from side to side. So you don't just hold the bottles straight under your nose and then smelling. What you need to do is waft it from side to side so that aroma actually gets smelt through your olfactory system. So each time you test, I want you to go outside, take a few deep breaths, and actually come back inside and then test other oils so that it clears out your olfactory system so that you can test again and get the right blend for you. So my special blend for labour and birth, I use lavender. So that helps to stimulate circulation and has a really calming effect. So a lot of women feel that they can't use lavender, so you could probably replace that with another oil or just leave it out altogether. There has been talk about lavender not being safe to use during pregnancy in the first trimester particularly. However, it's only spike lavender, which is taken internally, that may be a concern. Robert Tisserand actually writes a really good article on this. So he's actually a really high-level researcher, world expert and advisor on aromatherapy and essential oils. So he says that lavender is actually not a uterine stimulant, so it is safe to use during pregnancy, labour and birth. The other oil that I use is rose essential oil. It's a uterine relaxant. It helps to soften the ligaments, which enables the pelvic bones to expand and also gain elasticity after birth. When I originally did my aromatherapy training back in 1995, I was taught that rose essential oil, again, shouldn't be used during pregnancy as it was a menagogue. However, I contacted Robert Tisserand again, and I spoke to him and asked his advice on this. And he said that there's no evidence that rose oil stimulates menstruation. Even if there was, this would not mean a contraindication in pregnancy, because menstruation and abortion are totally different things. So that was really interesting for me to hear that. I also use neroli essential oil. So this works on the nervous system and helps women to breathe more easily, has a calming effect, increases the oxygen supply to the blood and brain, and helps women avoid hyperventilation as well. And then my favourite is clary sage. So this helps to facilitate labour and birth. Now, clary sage, there's a bit of a myth that clary sage will help you to go into labour. Clary sage doesn't do this. What it does is it increases whatever is going on in your body at the time. So it works on the nervous system by relaxing the lower part of the spinal cord. It encourages more effective contractions and it helps labour to progress. So if your body is already starting to have contractions, then using clary sage can actually promote and increase that as well. So although clary sage is one of my first choices that I suggest during labour, it's also very powerful and it has a very strong, overpowering smell. So it can cause mums to feel really high. It can also cause headaches and nausea if overused. So the way I suggest that mums use clary sage, if they're just using clary sage, is put a few drops onto a piece of material like a flannel or a hanky, or even those Chuck super wipes rather than tissues, and then smell that when you need it. And then when it starts to get too overpowering, pop it into a seal lock bag so that you get rid of that smell. So the labouring mum can actually use that constantly, or she can use that intermittently. So it really depends on how she's feeling with that smell. Now, I also use vanilla. So vanilla is not really an essential oil, but a resin. It's obtained by a solvent extraction process of fermented vanilla beans. However, we know that vanilla also helps to release endorphins and encourages calming and relaxation. So a really great blend for pregnant women to use from 37 weeks onwards and through their labour. So here's my recipe. I make this up for women to use from 37 weeks and during labour. With a 50 ml carrier base. So I use a really good base oil. Jojoba, camellia is my favourite, or apricot base oils. Then I add up to 25 drops. So here you actually have the recipe with 22 drops, and you can add extra drops if you feel you need it. So the recipe is the 7 drops of clary sage, 4 drops of lavender, 4 drops of neroli, 4 drops of rose, and then 3 drops of vanilla. So you add that to the 50 ml base oil, and there you can see a really good amber coloured bottle, so you can use that for storage, or you can add those drops to some really good base cream. So there's lots of creams that you can make up yourself. If you wanted a really good recipe for making up the cream, then let me know and I can send that through to you as well. So you can also use this blend in a spray bottle. So again, just using 50 mils of water, but remembering that essential oils don't dissolve in water. So every time you use that spray bottle, you need to shake it up vigorously. And then a few spritzes around the mum or around the room, and then she can actually breathe that aroma in, and it helps her to feel calm and relaxed. And if you're using that prior to going into labour, it's conditioning your mind for relaxation. So when you're listening to relaxation music at home, really good option to have the spray bottle around you at home and get your partner to spray that while you're listening to your calming meditations or hypnosis or music as well. So visual. When you visualize, this creates that mind-body connection. So have images or visuals that help you to focus on the birth that you want to have. So looking at this image, does it remind you of anything related to birth? For some women, it may do. For others, it may not. So you need to find images that really help you focus on your birth. So using visualization can create a mind-body connection, really strong connection as well. So I love the sunflower. For me, looking at this image, I can imagine that the center part is the baby's head crowning, okay, and the petals are the perineum, opening gently and delicately and slowly. So exactly how you want your perineum to open. So you need to find images that really resonate with you and help you to think about your birth, help you to think about the birth canal, help you to think about your pelvis opening up, your perineum opening and stretching really widely. And for me, like I said, the sunflower does that for me perfectly. So other visualization techniques could be preparing a vision board. So this is actually one of my clients prepared this vision board and put positive affirmations on the images so that it helped her whenever she looked at that, she could say those words to help her to feel love and strength and confidence and know that she was secure. And that she was happy and she was healthy and her baby was healthy. Positive affirmation posters as well, printed on beautiful images. So you can use so many different images or your own photos. Look at lots of images of positive birth. Look at images that help you to feel safe and calm. So maybe holiday photos, as you can see here in the vision board, lots of holiday photos. Again, images of flowers. So for me, the sunflower. But you can choose a flower that might really resonate with you and help you to think of your birth path opening up really wide and everything moving slowly and gently and flowing in time with your baby. Look at really strong words. So again, on this vision board, all of those words helped my client to feel she could do this. And actually having words, I can do this. I am doing this. Search for positive birth videos on YouTube. So you can actually watch women giving birth in a really positive way. Have a look at the way they're birthing. Have a look at the different positions that they're birthing in. Have a look at what's going on in the background. Have a look at their environment. So really visualizing the things that you want to incorporate into your birth space and into your birth. Look at ultrasound photos of your baby as well. So have that as one of your images to look at and know that is actually your baby. You're going to be birthing that baby very soon. You're going to be holding that baby in your arms really soon. So the more you're actually looking at that baby in that ultrasound and knowing that is your baby, and you're going to be birthing that baby really soon, and holding that baby in your arms can give you such power and confidence. Make sure that your birth support people observe what is going on in the birth environment. So I've already said this, and I really reinforce this because this can really change the whole environment. So if things don't look nice, if things are not calming and not reflective of the mum's birth preferences, then that can make a really big difference to the mum's mental state as well. So listening, getting as much music together that you can listen to can also really help with relaxation. But also keeping in mind that what you think you might like to listen to in labour may be completely different to what you want to listen to in labour. So I always suggest that you have a real smorgasbord of playlists. So you could have classical music, you could have nature sounds, you can have your meditation, guided meditation, or you could have hypnosis tracks, which is what I recommend to women to use during their Hypnobirthing Australia classes. You could listen to some rock and roll, you know, some really upbeat music, hip hop, country and western. So make sure you've got a whole range of music, because you know, sometimes I've seen women go into labour, and what they thought they wanted to listen to, they really didn't want to listen to that during labour. And also, a lot of women don't want to listen to anything. So I've also seen women have this huge range of music, and then they get in there and they get into that quiet zone, and it's like, no, I just want quiet. I don't want to listen to anything. I don't want to hear anything. I just want to, you know, go with my body and work with my body in silence. So this is a really important thing to keep in mind for the birth support people. You know, if the mum doesn't want to listen to anything, then it means she wants silence. And also, some women like to make lots of noise. Now, with noise, I really recommend that you save your you save a lot of noise for the end, rather than making lots of noise all through your labour. Because I've actually come across clients who have made lots of noise, and their throats are so sore and they're so exhausted by the time they get to actually birthing, where that noise could help them to relax their body, because that vibration of the noise actually moves through the body and helps the muscles to relax. So it is beneficial to use those noises. When you are making noise, I want you to really think about low, deep, primal noises. So I want you to think about a cow mooing rather than a screeching cockatoo. Okay, so it's really low and deep. It's moo. Okay, really low and deep. And that's something that the birth support people can remind their mums as well, is that if they are high pitched, you know, you can just be saying in the background, low and deep. And you make your voice low and deep. So they actually resonate with that, and then they start to move into that low, deep sounds rather than the high pitched screaming. When you've got that high-pitched screaming, it actually causes tension throughout the body, which means that everything is closing up, everything is getting tight and tense, and that's not what you want when you want your baby to come out. So eating and drinking during labour is also really important. So this comes under the taste sense. So many hospitals still have a policy of no eating and drinking during labour in case you have to go for surgery. So these policies are now outdated and based on the work by Dr. Mendelssohn in the 1940s. They indicated that under general anaesthesia, there was a possibility of acidic stomach contents entering the lungs and causing damage. So recent studies have now shown that it's important for women to eat and drink regularly during labour to ensure that they maintain their blood sugar levels and their energy. Even the American Society of Anesthesiologists have done a press release recently which states that labouring women would really benefit from having light meals during labour. I also want you to be aware of and understand ketosis. Ketosis is a natural response to your body being subjected to prolonged physical activity, just like labour, without replenishing your energy stores by eating or staying hydrated. So the effects of ketosis on mums and babies are still not clear. However, we know that it does cross the placenta and the baby may have acidic blood and increased lactate levels. So this condition causes mums to feel nauseous. They may start to vomit. They may get headaches, and it can make you more exhausted. So it can also, or it's not known whether or not this can actually cause labour to slow down and stall, but it has been linked to difficulty in establishing breastfeeding. So the best foods to eat during early labour are carbohydrates like grains and pasta, as they give you a slow release of energy. Now, simple carbohydrates during active labour, such as fruit, juices which are non-acidic, and honey will give you a quick burst of energy. Obviously, sugary foods are less ideal. They give you that immediate boost of energy, but they quickly make you feel worse. So I always suggest a teaspoon of honey can really help control ketosis, so make sure that you take some honey with you in your food bag. It's also beneficial to eat small portions of energy foods regularly, so at least every hour, than trying to eat a full meal. So when you're in established labour, you may not want to eat too much. So liquids are also easier to get down. Smoothies are a great way to get some fruit, particularly bananas, yogurt and protein into your body. So it's recommended that you try and eat small amounts every hour. You can have smoothies already made up in shakers that you take with you to the hospital in a little esky or a cooler box, and then make sure you shake them up really well during labour and just sip those through labour. Coconut water. This is a must-have. So this contains electrolytes and is perfect for hydration and energy. It is an acquired taste, so you may need to start drinking during pregnancy to get used to that taste. If you can't drink coconut water, then isotonic drinks with electrolytes like Powerade are also really good. But obviously, coconut water has been found to cause less nausea, less fullness, and doesn't cause upset stomach as well. So at the end of the day, there's no right or wrong list of foods that you can have. Just eat whenever you feel like eating, because some food and drink is better than nothing at all. Remember to sip your drinks through a straw and go to the toilet regularly so you can have a wee, so that your bladder doesn't stay full. When your bladder's full, that can inhibit baby from moving down into the pelvis and into the birth canal. If your care providers have a no eating or drinking policy at their hospital, you need to discuss this with them earlier on at your appointments and provide them with evidence that their policies are outdated. So remember that policies are based on guidelines, and if your hospitals don't keep up with the current guidelines, then their policies are outdated. So again, I go back to going to independent childbirth education classes so that you can be provided with updated evidence-based information. Chocolate. So this is my favourite part of sharing with mums, because I'm a total chocoholic. Research has now shown that chocolate is an excellent trigger for endorphins. So I don't suggest that you sit down there with a whole block of chocolate and try and eat that during your labour. What I suggest is that you get your favourite chocolate and you break it up into, you know, little pieces, and you put that into a container. And then you pop a little piece of chocolate into your mouth every hour or so, and you suck on that, and you allow it to dissolve, and you allow the sensation of that chocolate just melting on your tongue. So obviously the research was around dark chocolate, but if you don't like dark chocolate, stuff it. Just go with your favourite chocolate. Okay, so that's a real treat that you can have during labour. Focus on the feel of the chocolate on your tongue. Really savour the flavour. Really enjoy it. Make it, you know, make it a real mission to enjoy that piece of chocolate in your mouth for as long as possible. Also, making up some bone broth before your estimated due date, and have it in the freezer, and then defrost it when you go into early labour. Once defrosted, you can heat that up and put it into a thermos and take that with you to the hospital, or you can just heat it up in the patient kitchen as well. So you can sip that throughout your labour, and it helps to replace electrolytes and gives you sustenance during your birth. So I really encourage you to make up some bone broth. It's amazing stuff, and it will really help to give you energy. It will really help to sustain you through your labour. So I want you to think about high energy foods that you can take with you to ensure that you have lots of sustenance and energy. So some examples are making up some wholemeal sandwiches with Vegemite or peanut butter or honey, having some plain pasta or homemade slices, protein balls. Blueberries are a great source of energy. Having some pureed fruits, applesauce, bone broth, bananas, dates, avocado, fruit and nut selection, boiled eggs, muesli bars, cereal bars, yogurts in those suck-on packs, those squeeze packs, they're really handy. Rice cakes, biscuits and crackers, jelly cups, and obviously your chocolate. You're not going to forget that. Having drinks that will also give you energy, keep you hydrated, and be a substitute if you don't feel like eating. So that can be really beneficial as well. So making sure that you've got filtered water, making sure that you have protein shake powder and take a shaker with you so that you can make up protein shakes. Have smoothies already made up, like I said, in a shaker. Your coconut water, your almond milk, isotonic drinks like Powerade, apple juice, and raspberry leaf tea. So I'm actually going to send through a really comprehensive list with these notes as well, so that you can really put together a list to pop in your freezer box. Okay, so I've crammed in a lot of stuff there, and I feel like I've really raced through. But now's your opportunity to talk about or ask me any questions. If I can't answer all the questions in time, then I'll include the answers with the link when I send out your video of today's webinar. So if you wanted to ask me any questions, you can just go to the chat box and type in your question there. And while I'm waiting for any questions to come up, I'll tell you about my Back to Birthing Spacing online course. So I've actually designed a Back to Basics birthing course. It's an online course, very comprehensive, jam-packed full of information for your pregnancy, your birth, and your immediate postpartum period. It is 6 modules, and it includes what's happening in your body, your mind-body connection, your hormones, relaxation techniques, how fear and emotions affect your birth, the stages of labour and what to expect, timing your contractions and when to go to the hospital or call your midwife, guidance for your birth partner and how they can support you more effectively, natural and medical induction methods and pain relief, using essential oils safely, setting up your birth space, labour and birth positions, looking at special circumstances, looking at delayed cord clamping, looking at placenta encapsulation, what to take to the hospital with you, information and support for the immediate postpartum period, looking at bonding, breastfeeding, and also, this is my favourite part of the course, is teaching you how to change a nappy to help prevent colic. So a lot of women are taught the standard way to change a baby's nappy, and more often than not, this can actually cause babies to have colic. And there's so much more to the online birthing course as well. So here's the link, and for today, for the next 2 weeks, I'm doing an early bird price. So the launch of the online course will be on the 28th of July, and I'm offering everyone who watches the video or is here today the early bird price for $100 for the first 30 people who sign up, ready for the launch on the 28th of July. This is a massive saving of $195. So it also includes a private Facebook group where I provide ongoing support to those who have registered, along with further webinars, videos, and evidence-based information. So you'll receive lifetime access to this online course, so you can go back and revisit whenever your next babies choose you. So there's the link, and you'll also get the link in the video notes as well. So, and I think Dave's just put the link up in the chat box as well. So that will give you the early bird price of $100, and that's a saving of $195. So I'd really love for you to join me. So does anyone have any questions? There doesn't seem to be. Oh, here we go. Does anyone have any questions? You just need to type that into the chat box. Okay, well, if there's no questions, that's the end of the webinar. I do have another webinar planned for Thursday, the 28th of July at 6 p.m. Perth time, and that's different to the webinar that I've done today. It will be focusing on more tools and techniques for pregnancy, labour and birth. And I just wanted to thank you for joining me today, and I hope that you found this webinar really helpful. So I'm looking forward to sharing more with you. And you'll receive the video link to today's webinar probably in the next 24 hours, and that'll have lots of extra information that I've mentioned as well. So thank you for joining me, and I hope to speak to you soon. Bye.